Good evening, friends, and welcome to this session on home ergonomics. This is the seventh session in our Dream Se Dar Tak series. This was a series which we launched on 26th of December as a result of so much feedback that we were getting from people that COVID has been 2020 has been a tough year, and a lot of people are struggling with fear, anxiety, etc. And we thought, why not launch a program which will help everybody deal with the challenges that people are facing, which is stress, anxiety, and so many other things. And I'm very happy to share with you that this program has received a very good response. I have just posted in the chat the link to our YouTube video, where the video of this session and the other sessions, previous sessions, are available. And what we thought that we will do in this as a part of, I request everybody to please mute themselves. Uh, what we will do as a part of the series is to focus on the four dimensions of human wellness, which is physical. Just give me a minute, please. Can everybody mute themselves? Thank you. So what we launched was a series of 8 sessions focusing on the different dimensions of human wellness, which is physical wellness, financial wellness, emotional wellness, and intellectual wellness. And we did 2 sessions on financial wellness, which were very well received. And we followed it up with 2 sessions on emotional wellness and emotional intelligence, which are titled Change Your Life's Orbit. These sessions were conducted by Astha Diwan, and those videos are also available on the YouTube channel, which the link I just shared on the chat. And this is extremely popular. It's ranked number 2 on our YouTube channel. You can please go and subscribe to our channel. Some of you are joining us for the first time and may not have subscribed to our channel. Then we had one session on on critical thinking, which was on developing our intellectual side of the being. And that session was also very well received. It's ranked number 3 on our YouTube channel. And today's session is on the physical health. And we have got a very accomplished person, Dr. Gagan. But before I introduce Dr. Gagan, I would like to take a minute to introduce mindful living to you. I started mindful living in 2018. Prior to starting mindful living, I worked in the corporate sector for about 25 years in senior management roles. In the last 3 years, we have done over 200 sessions in leading corporations in India like IBM, CII, Kotak Life, SDFC Life, Times of India, Airbnb, Tata Group, EXL, etc. We are regularly invited by universities, insurance companies, to address their students and their clients on a wide range of topics, which include team building, emotional wellness, how to deal with stress, anxiety, depression, etc. So wide range of, we address students to mid-management executives to leadership teams. So there is a fair bit of work that we have done in the 3 years that we have been there. And I'll now come to introducing Dr. Gagan. Dr. Gagan is a friend, and he's a very well accomplished physiotherapist. He started his career with AIMS nearly 20 years back. And after that, he worked with the Indian national football team for about 5 years. And during that period, he traveled to over 20 countries. And since then, he has done a lot of work in in this area. He was also the lead physiotherapist for John Abraham's football team. And he's got many, many accomplishments. I'll let him talk about it. And I would now like to invite Dr. Gagan to talk to us about home ergonomics. One of the things that has been very challenging for people during COVID times is working from home. And earlier when I used to commute, I used to do 100 kilometers of commute every day, and that used to cause back pain and neck pain for me. And I thought when COVID struck and I'm going to be working from home, I'll get a relief from my back pain and neck pain. But unfortunately, it did not happen. Even while working from home, sitting long hours leads to different kind of pains if we are not mindful of the posture that we have. So I thought, and that impacts the productivity. And many times, what people tend to do is ignore this pain, and then it has very serious consequences. And many a times people are not able to attend to the to these niggling pains that we have in our spine and neck and back, is because they don't have access to physiotherapists or to right medical advice. And we thought it will be good to have Dr. Gagan come and talk to us. He has addressed many large he's invited regularly to speak on many forums, and he has addressed large corporations and thousands of employees in those companies. I couldn't have found anybody more suited to conduct this session today. So on that note, Dr. Gagan, over to you.
Thanks, Ashish, for introducing me to the group, and I thank your organization, Mindful Living, also on behalf of which we are going to have this webinar today. Thanks to all the participants for being here. Ashish, if you can stop sharing, then I can start my
Sure.
slide. So as we all know, like life has changed in last 1 year. Means a lot of things have changed, and people who have been working, means the whole work culture has changed over past 1 year. So this today's program will focus upon how things have changed and how the office has moved to home, and how we can help ourselves in working more efficiently, keeping our productivity in mind, and also our physical aspect, means our bodies in mind, how we can make a balance between work and our physical being. So we can, if someone has a query or something, we can take that in the end. And you can either type, or if you think you can type in the chat box, you can keep it, but we'll attend to that at the end of the webinar. So as Ashish has introduced, I started off my career at AIMS, and then I started working. I did my post-graduation and specialization in sports injuries, and started working in mainly football. So worked with some of the one of the renowned clubs, which is JCT Mills Football Club, and then with the national team. And then I moved on to Northeast United for a season, and now I'm promoting my own company, which is Active Prehab, which deals with preventing problems before they happen. So actio means activity. By the means of activity exercises, we want to prevent the problems that one may face, which is more on the non-communicable side of diseases. So we all must have suffered. I believe all of you must have, and including me, have suffered some kind of spinal pain in our life. Or if not, then there is a good chance that we are going to suffer it. So the lifetime prevalence, this is according to WHO, that the lifetime prevalence of non-specific low back pain is about 60 to 70%, which is very, very high. So almost everybody, earlier it used to be 80%, but now it has come down slightly to 60 to 70%. So almost everybody is going to suffer at least one episode of low back pain or neck pain in their lifetime. At any point of time, 1 year prevalence is about 15 to 45%. And this prevalence increases with age. Means youngsters, they don't get that much of back pain. But now recently we are seeing that even among youngsters, those who are going to college or school, they are also, means even the teenage and adolescents are also facing this problem, because they are also now sitting for longer durations, preparing for their schools and preparing for entrance exams and for different reasons. Okay, and it is now seen among them also that the rate is increasing, but the rate generally increases with age, and 35 to 55 is the most vulnerable age for low back pains. And this is, as you know, that this is also the most productive time of someone's lifetime, looking at the financial aspect, and there are other responsibilities also. So work wise, what are the risk factors for low back pain or neck pain? So if there's a heavy physical demand, like the job which requires a lot of bending, lifting, pushing, pulling heavy weights, so that could be one of the factors that can predispose someone to low back pain. Or if there is prolonged sitting and standing, means static postures which are sitting or standing postures, that may lead someone risk, put them someone on risk of developing low back pain or spinal pains. Then female gender, in case of teachers, it has been seen, as we were taking a lot of webinars for teachers, we did a lot of awareness programs for teachers during the lockdown, because they were definitely the people who are in tech, on the tech side, they are already um, they are conditioned to sit for longer duration in front of the computer, but teachers were the one who were suffering more these days, because they were not so habitual of sitting long hours in front of the computer. So in teachers, female gender is seen to be suffering more than males, and the working hours with computer are directly proportional to the risk. So repetitive movements of, if someone is in a job where it requires repetitive movement of the spine, then that also leads to strain in the spine. So I'll just talk a bit about the posture and the curves of the spine. Our spine is not a straight. It's not a straight organ. It's curved at different parts of the spine. So mainly people come and say, I have cervical. So cervical is the first part of this spine. So the neck part is called as the cervical spine. It has a curvature. As you can see, it is convex in front and concave on the back side. And then there is thoracic curvature to accommodate our lungs and heart. And then this is convex posteriorly on the back side and concave in front. And the lumbar part, which is the lower back, is convex in front. So it is curved. The spine is curved, and these curves are to provide us the most efficient posture to work during our lifetime, whatever work we do. So according for that, we have been given these curves in our body, in our spine. There could be people who may have certain deformities in their spine, which predisposes them to certain kind of pains. So these deformities could be a curve in the spine, which is scoliosis, or there could be a kyphotic, means the increased curve of the thoracic spine, or this could be hyperlordotic, increased curve of the lumbar spine. So people come and they ask, may I know how many of you have suffered? You can just mention in the chat how many of you have suffered a back pain or neck pain. You can just type in your chat, or you can show on your video. So Ashish is one. Okay. So common term which is heard is the disc. You can just raise your hand or put in the chat. Yeah. Yes. And so a lot of people in this group also have suffered neck and back pain. Yes. So you must have heard very common terms like vertebra and the disc. So I'll just it's people who are non-medicos, they don't have much interest on the anatomy side, but still it is interesting because these are very common terms, disc and the vertebral column. So vertebra are the bones on which make our spine. They sit one over other and they form the spine. And from the vertebra, there is a central canal from which passes our spinal cord. So the spinal cord passes from there, and there are other foramen, or there are holes in between the two joints from which the nerves come out, and these nerves supply to the muscles of the upper limb in case of neck, and to the lower limb, means of the leg, in case of lumbar spine or lower back. And as you can see on the other side, in between the vertebra is a disc. So disc is basically a cushioning material in between the vertebra, which works to cushion it. It cushions the vertebra and avoids compression on the vertebra. And this is made of two major portions. Outer part is the annulus fibrosus, which is more fibrotic or more like cork. And the material in between is more like a jelly, which is nucleus pulposus. As the name says, pulposus like a pulp, and annulus fibrosus is more fibrous, like a cork. Okay, so in general, the important thing is, because you must have suffered, some of you must have suffered neck or back pain, along with maybe shoulder pain, or maybe with the leg pain. So the nerves that come out of from these foramen or these holes, when they get compressed, then it leads to pain in the upper limb, which is arm or shoulder, and lower limb, which is thigh, leg part, in case of lumbar spine. So disc is the material in between the vertebrae, which is meant for cushioning basically. And you must have heard these terms, disc herniation. I'm just mentioning a bit about disc herniation. Okay. So as I told you, the outer part is like cork, and the inside that part, there is a jelly-like substance. So at times this cork-like substance, it develops certain cracks, and as the cracks are developed, this jelly-like portion moves out towards the cork, towards the annulus fibrosus. It can protrude out, which is called prolapse. Then it can extrude, means almost come out of the cord part or the fibrous part. And if it comes out completely and is hanging, that is sequestration. So these are different stages of disc herniation. I will just show you this posture. Yes. So as it is more like a jelly. So when we bend forward, if we are standing, so this shows the disc. Okay. And then as we bend forward, as the vertebrae, they compress forward, the disc protrudes backwards. Disc moves outwards. Okay. And as the disc protrudes backwards, then there's a chance, that this is the foramen from which the nerve passes. So there's a chance that the nerve gets touched. If someone is bending backwards, so the vertebrae are bending backwards and the disc moves in the front side. So here there are no nerves. Okay. And similarly, when we move to one side sideways, then the compression is on the side which we are bending. So I just wanted to show you this so that when we discuss about the posture and which exercise can correct few things or help in relieving the pain, then you can have a better understanding about it. So common causes are postural neglect, sitting and standing for long, as we discussed, working in stoop posture, which is ergonomics. We will discuss and we will look at it again in detail. Then lifting, coughing, sneezing. So coughing and sneezing usually makes us bend forward, isn't it? And as I showed you, when we are bending forward, then the compression on the disc happens and the disc moves out posteriorly on the backside. So maybe that could be one of the reasons when someone coughs or sneezes, then the disc moves backward and it can cause pain in the back. So prolonged lying or resting, which is another reason that can lead to pain. Relaxing after vigorous activities. Pregnancy changes the posture, so it puts more strain on the joints of the lower back. Old age, because of the degeneration, leads to back pain. Then osteoporosis. Maybe you are able to relate someone you know or yourself with some of these things which aggravate or which led to your pain or someone else's pain, very well. Osteoporosis, especially in case of elderly, when the bones are going weak, they also cause pain. Then there could be psychological reasons. Our threshold for pain reduces when we are stressed. Our threshold for pain reduces when we have anxiety, or there could be other work-related or compensations related issues also, which can lead to back pain or are related to back pains. A very important note here. Earlier I used to put this slide later in the program, but now today I'm putting it earlier because a word of caution here that we should be very careful. Most of the back pains are non-mechanical in nature. About 85 to 90% of back pains are non-specific or mechanical in nature. But there are some serious problems also related to back pain. So those should not be ignored or should not go on ignored because we don't understand and we take everything very normally. So red flags are the conditions when you need to reach out to a orthopedic surgeon or physician immediately without any delay if you find any of these things related or accompanied with your back pain. So as we saw that there is a spinal cord which is passing through the main foramen. main foramen, then if that gets compressed, which is the main nerve, then these things may happen. So in case something like this is happening, then you should immediately consult a physician or a surgeon. So what requires immediate referral is loss of sphincter tone, means if there is you are not able to control or get a sense of urine or passing stools. So if such a condition is there, then you should immediately go to a medical practitioner. If there is saddle anesthesia, when we sit on a horse, the part which comes in contact with the saddle, which is the inner side and the back side of the thighs, and also around the anus, if in that region there is anesthesia, if there is numbness, okay, so that is an alarming sign. If you feel that, if you don't feel anything in that area, or if someone who known to you does not feel anything in that area, then that is alarming. If there's gait disturbance, basically if there is too much pressure on the nerve and there is weakness in the muscles, which leads to disturbance in the walking pattern of someone, if someone has developed a foot drop or some other weakness in the lower limb, then immediately needs to be seen by a specialist. So these are the emergency ones. And then there are other ones which we need to consider while we are treating people with back pain. So these are no emergency red flags, but there are considerations while treating people. So those who are younger than 20 years of age or older than 55 years of age, we need to be careful with them. If there is trauma, if there is violent trauma, if there is constant progressive non-mechanical pain, there could be fever associated with it, which could be because of some kind of infection, or if there is history of malignancy, means there has been history of cancer or infection, or any neurological disturbance, as I told you, night sweats and weight loss. So all these are the considerations mainly for clinician while they are treating the back pains. So quickly, we'll go through the presentations. Means how do people present with back pain? Maybe you have suffered these. If you can put in the chat box, if you can relate to any of these symptoms, the red marks are the symptoms. So there's the case of neck pain and arm pain. So this one is the central. If you can type along, if you have suffered any of these. So commonly people suffer pain in the central region of the neck, or it can go to any of the sides. Okay, in cases which are severe kinds, it can go to both the sides. Not this part is not disturbing, but if it goes in the arms on both sides, then it could be a severe one. It can travel towards one side along this upper part of the shoulder, and then it could be around the blade, the shoulder blade. The pain could be around the shoulder blade also. Okay, so central, yeah, Ashish. And then it can travel down the arm also, below the shoulder joint up to the elbow or below elbow. So these are the presentations which we see in case of neck pain. Similarly, in case of back pain, there is central presentation, or central can be spread over towards both the dimples, towards the venous dimple, from one dimple to the other dimple in the belt area, or it can again move down to one of the limbs. As I told, going in both the limbs is a sign of severe problem. Could be a sign of severe problem, and it can go up to the knee or below the knee joint up to the leg. There could be numbness or tingling associated with these because there is a pressure on the nerve. So we have already seen this, like what happens if we are sitting in or we are doing certain activities in forward bending or backward bending. Now, I would ask all of you to stretch your finger like this for a moment. Just stretch your finger like this for a moment. Are you getting any pain? Any discomfort? I believe most of you won't be getting any discomfort or pain with this. Okay, but if I ask you to hold your finger like this for 1 hour, what will happen? I'm sure all of us will get pain. Same pressure, same load, sustained for a longer duration.
बोल के भेज देना, मैं बंद कर वो साइलेंट कर दूंगी.
Please put yourself on mute.
अच्छा कुछ नहीं.
Please put yourself on mute. So if we stretch like this for a shorter duration, there is there won't be any pain. But if we sustain this for longer duration, everybody would get pain. So what I mean here is, when we are sitting normally with a slightly awkward posture for a shorter duration, then we may not suffer, or we may not experience pain. But if we sustain that posture for longer duration because of the constant stress, we may get pain. Uh, so the posture means sustaining the same posture for longer duration can lead us to pain. As you can see, if we are sitting, not sitting in the proper posture, if we are reclined and there is pressure, the pressure increases on the backside, and if we are like that for longer duration, then there is a chance that the sustained posture may give us pain. So that, yes, uh, we can take that, if the time permits, then we can take bit of your problem. We can do that later. Okay. So what happened when everything moved to home? Okay, so this is what happened when everything moved to home. Because we were not ready at that time, probably most of us were not ready. And as we were doing a lot of telehealth in those days, it was very interesting experience for us. During, especially from May, June onwards, May to September or October, we suddenly had a lot of calls regarding neck and back pains to us. And as we were doing telehealth, so we were doing video calling also with our patients. And whenever we used to ask them, how do you work, they would always say, I use a proper workstation. Are you using workstation? Yes, I'm using workstation. Let us see your workstation. And when we used to see or look at the workstation, it was a coffee table, a coffee table for bed, which is being used, and people are sitting most of the time in their beds and using that small table to work, keep their laptops and work from there. So we have almost experienced all these scenarios. As you can see in this image, the back is not supported, the table is too low, and the person is bending forward to work. Here, people have worked from bed in any of the postures, while lying, while sitting, while lying on belly, while lying on the side. So people have worked like that. And couch has been the workstation, where again people were in awkward postures working. And in this, the lady that is sitting here and working on this table, the back is unsupported, the table is too low. So as things moved to home, we didn't have proper workstations, and everybody was working from wherever he or she could. So these are again some of the examples how people must have worked while working from home. So what does it do if we are bending forward? If the ergonomics is not proper, then this part, the upper part of the neck, it suffers, because the neck is like this most of the times. And as it is like this, then this part is compressed and we get headaches. I didn't touch headache part in that neck presentation. Some people do get cervical headaches, and cervical headaches start from the back side and go up to the front side till the eyebrows, because there is a big muscle here, occipitofrontalis. There's a muscle which gets tensed, and the upper cervical spine itself gives pain in the occipital and the occipital region, or the back of the head region. Then this part is strained because it is not supported and bending forward. So upper back pains are very common. That's pain. And this, as you can see, the arm is not rested properly, the elbow is not rested properly. So that makes someone prone to elbow pains also. So this is a proper workstation. I'll just pick up cues from here. Maybe this won't work for home, or maybe it would. So eyes, we all know most probably, there have been so many webinars, there have been so many in-office seminars also, or there are people who are searching for how I can best work, then they must have seen this image many a times. But the important thing is to follow what is there in the image, and how you can follow those things. I'll try to cover that in the next few slides. But it is very, very important to try to follow these suggestions. So the eye level should be almost at the top of the screen, which it should be straight. Then elbow should be at 90 degrees. The hip, knee, and ankle should be at 90 position. Okay, so if the chair is of adjustable height, adjustable chair, then that is best. I believe, and I have been advising people who know that they are going to work from home for a while now, maybe for 6 months or a year or longer or shorter. But if you're working from home, then it is a recommendation to use a proper workstation, a proper good table, and a proper good chair while you're working from home. And keep all these considerations while you're working. The height of the chair should be adjustable. Here the handrest is also adjustable so that your elbows are resting on the handrest part. And the back of the chair, the support that is provided by the back of the chair is dependent on the seat length. So if you are a short person and your seat length is too long, then probably you won't be able to reach the back side of your back won't be touching the backrest of the chair. So if you're going to choose a chair, then try it out. Sit on the chair, look at the thigh length and the depth of the chair after sitting on it. And then you can adjust the height of the computer, whether it is your laptop or your desktop, according to this. So this is one of the suggestions or one of the examples while working from home. As you can see, the laptop is propped up, the hand is resting, the back is resting. Okay, even if you're sitting on the sofa, even then it is so. Prefer to sit on an office chair, which, as I told you, is better suited for the job because it is designed according to your back and to work while sitting. Okay, your feet should not be hanging down. It is very important. Our furniture is basically not meant to be used like it's not like the office furniture. The couch or the sofa are usually low. The support is way behind. It could be sagging kind of a chair, this sofa. So you have to be very particular when you're working, sitting on the sofa, that your back is rested. It's preferable again to work while sitting on the office chair. This is another example. So standing posture, working while standing is one of the ways in which you can prevent stress on your lower back and also on the cervical spine. So you can use any of the cupboards and then place your laptop not too low, but at the level of your eye. At the eye level, you can use a lot of books or you can use boxes to place your laptop at the right height. And this is, I believe, a dining table. Okay. So if you're using your dining table as your office table, again, you need to be careful about your feet. Those should not be hanging down. So here a Pilates roll has been placed under the feet so that the feet are supported and there is no strain on the lower back or the thigh region. Then back is properly supported. This chair was a bit too low, so cushions were used. Cushions were used here to elevate the person to the right level, and the height of the laptop, as you can see, is again at the eye level. So these are the adjustments, these are the modifications which can be done at home to work efficiently without much back pain or without much strain on the neck and the back region. So here, if you notice the head part, the neck part is poked forward. But when it is corrected, then it is more straight. It is slightly backwards. So we have to take care of the head part. As we are working for longer duration, we tend to poke forward. Again, as you can see, the relation between the shoulder and the earlobe should be here. Okay. But while we are working, either we get tired or our back is not supported, or we are sitting for too long a duration, then we start to go like this, which is a forward head posture. And as you can see, as I'm going forward, this part will be strained and this will be compressed. Behind the ears part would be compressed, which can lead to pain. This is again another example. Elevation to reach the correct height. Laptop right in front of the eyes. There's something under the feet again, or a standing posture, a standing workstation. So here again, the table and these baskets were used with covers to support the box, and baskets are used to support the laptop. And this is another example, as you can see in the first image. There's slightly forward head, the back, the shoulders are coming forward. Okay, someone is not very attentive, or not very uh, upright in posture, but as soon as you can see, like this part must be stressed in this posture, but as this lady straightens herself up in a good posture, then there is no strain on this side. So we should not be walking slouched or slumped. So even when you're sitting in the chair, so it's very important that your back is supported. You could be sitting on the chair, but yet your back is not properly supported. Okay, so while you are sitting, you can use a lumbar roll. A lumbar roll is very, very, very beneficial. We have treated, and this example I've been quoting for last 3 months. There was an employee, a girl, a female, who was 28 years old, and she is a CA, I believe, and she was sitting for long hours, and her pain was not getting relieved for a long time, even with the therapy and everything, with all the precautions. But as she was suggested to use a lumbar roll, initially she was reluctant to use that. But later, when she started using the lumbar roll, there was a drastic change in her condition in a very little amount of time. So lumbar roll supports your back adequately, and as spine is linked, it is linked. Our back, as soon as our back is corrected, our neck is corrected, so the upper back pain went away. If you don't have a roll, lumbar roll, then you can use a towel roll. You can roll your towel like this and tie up with a thread, and you can use this. The problem with towel roll is that if you move slightly ahead, then it will fall down. It's not self-supporting. But in the lumbar roll, usually there are straps around which can be put on the in your chair, or in your car while you're sitting for long. As Ashish was mentioning that he had to drive a long distances to reach his workplace, there are sure many people who travel every day 35 to 40 kilometers one way, means about 70 to 80 kilometers or maybe 100 kilometers every day. They should use this in their car, because we are sitting, and the condition of traffic is not very good in our city these days. So as we are sitting for long duration, uh, using clutch, paddle, and not able to move out of the car for 1.5 hours at a stretch, can put our back and spine at a risk of developing pain. So you can use this lumbar roll in your car also. It is very important to keep your spine upright. Okay. So a lumbar roll keeps your spine straight. As you can see, this curve was increased and the head was not properly placed. But as soon as there is a lumbar roll, the posture improves. So it is not just for it is lumbar roll, but it is not just for the lumbar spine. It is also for the neck or the cervical spine. Okay, sleeping posture. So this is again a very common question. Which way or how should I sleep? What kind of pillow I should use? Okay, I missed one image. But when you're sleeping, your spine should be as straight as you're standing or sitting or walking. Okay, so when you're sleeping, you need a thin pillow if you're lying on your back. But as soon as you turn to your side, as soon as you turn to your side and sleep on your side, if you don't have adequate support for your neck, either you will place your arm like this. Okay, and if you place your arm like this for 6 hours or 5 hours at night, next day morning, your arm and neck both would be stiff. And maybe a lot of people who have neck pains, they suffer pain in the shoulder also, or in the morning they feel a lot of stiffness in their neck. So you can use again a towel roll inside the pillow cover, and if this lady turns to her side, then her neck is supported. So from shoulder tip to the earlobe, this part should be well supported, right from here up to this part. This should be well supported so that you don't have to use your arm while supporting your neck, and your neck is properly supported all through the night. Okay, so sleeping posture, usually we sleep, most of the people, they sleep on their side, either right side or left side. Generally, people don't sleep for long on their backs, because as we sleep, the tongue rolls back. So we don't sleep for long on our back. But if you're sleeping on your back, it should be a thin pillow with a little curve around the neck, which supports your neck. And when you turn on any of the sides, then your neck is still well supported and not strained all through the night. Lying on your belly is not recommended, advisable for neck pains. That is the worst position while sleeping for the neck. Because when you're lying on your belly and sleeping for the night, then your head is turned to one side all through the night. You can't sleep like this. It is turned to one side. Okay. So, which can cause you strain in the morning or even at night. If everybody can please mute yourself. Please mute yourself. Thank you. So, how can we prevent spinal pains? We can prevent spinal pains by avoiding sustained postures, by using a lumbar support, take in between breaks. Yes, this is very important. Don't sit for long, as we have discussed, like sustained postures are not good. So don't sit for long while in one single posture. Get up every 45 minutes to 1 hour, maybe 1 hour, 30 minutes, but you must get up, stretch and exercise yourself. Get up, stretch yourself, do some exercises. I'll show you certain exercises now, and I want you guys to perform those exercises with your cameras on while I explain you about those exercises. So stretch and exercise yourself, stand up more often, work in standing whenever you get a chance, work in standing, and keep doing ergonomic exercises. So these are the ergonomic exercises. I would request all of you to please turn on your cameras.
Could everybody turn on the cameras, please? Then we can commence with the exercises.
Great.
Thank you.
If others can also turn on the cameras, those who can, good. Good, great, thank you. So we'll start with exercises for the neck and shoulder. As you can see in the image, first of all, let's do certain retractions. So as you can see in the first image, please keep your cameras on. I can see you guys performing it, and maybe I can correct you also if possible. So as you can see me from the side, okay, if I have to do retraction, I have to sit upright. First of all, sit upright. Sit upright. When I tell people to, means as straight as possible, as long as possible, sit upright, get that nice curve in the lower back. Now you know the curves of the lower back. So get a good curve of the lower back and straighten yourself up. And now retract means take your chin inside. So chin tuck. Don't bend forward, don't bend backwards, keeping yourself straight, your eyes looking forward, and then retract your chin inside. Do a chin tuck and go as far back as possible. You feel a good stretch here in this region. Okay. So do this 5 times. 2. Hold there for 2 seconds and then relax. Go as far as, if someone is getting any pain, please, if you are getting any pain in the arm, be very careful about it. Okay, I hope nobody is getting pain in the arm or suffering right now with the arm pain. So be very careful with these exercises right now, because I have not seen you. These are general exercises. Okay, so do about 5 retractions. And then these are shoulder rolls. This you can do anytime in the office or at home. Yes, clockwise, lift it up and back as far as possible, bringing the shoulder blades together. Yes, and repeat 5 times. Now go the other way, go anti-clockwise, Okay, lifting it up. So this is going to relax this region, the trapezius region, the upper trapezius region. Then there's a very good stretch. You bend your head forward. If someone is getting any pain or radiation in the arm, please be careful with this exercise. Okay, I hope nobody would get that. Bend your head forward and then feel a good stretch on the back of your head. Yes, keeping your lower back upright. Yes, all of you feel a stretch in the upper back, in the back of the neck. Hold this for about 5-6 seconds. Feel a good stretch. Good. Repeat it 2 more times. Bend forward. Hold for about 5 seconds, 10 seconds. Relax. Good. And now turn to one of the sides. Feel a good stretch in your neck. Keep your lower back upright. Again, every time, whenever you're doing any neck exercises, keep your lower back upright. You should be as long and tall as possible. Look on the other side. Feel a good stretch. Slowly come back. Again, left side. Feel a good stretch. Slowly come back. On the right side. Slowly come back. Okay. So these are for the upper back. Now coming to the trunk. In the sitting position only, like this, if someone is sitting on floor, then it won't be ideal, but turn to one of the sides. Hold your thigh with one hand and turn to one of the sides, looking back, and feel a good stretch in your upper back. This can be easily performed using the back rest of the chair. Hold it there for 10-15 seconds. Then relax, go on the other side, look back. Hold like this for 10-15 seconds. Come back. Repeat on the right side. Ten seconds. Relax. On the left side again. Relax. If while working you are getting tired, then it is very good to slouch down slightly and then elongate yourself. Straighten up and slouch down. Okay. Making a curve means if this is your lower back, then make a curve and then straighten it up. So you are slouching down, slouch down, 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 and then up, 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 as far as possible. So this relaxes your lower back. Should not be getting any pain in the leg while doing this. So the next one is the bridge pose. You can lie down, bend both your legs and lift the pelvis up. If we can do this, lie down and bend both your knees in the lying position and lift your pelvis up. Just lift the pelvis up, your lower back up and down, keep it down. Again, lift it up and down. In the same position, you can perform these rotations, keeping your both knees bent. Rotate to one side and back and on the other side. The alternate to these rotations is again to the bridging. The alternate is slouch and straighten up. Okay, slouch and straighten up. And for rotations is these trunk rotations, as I told you before. Okay. So while working, our forearm and our arm also gets tired. So we need to stretch our pectorals, that is the front muscles. We can do that by stretching at about 120 degrees and stretching taking our arms back and feeling a good stretch in the front of the shoulder, around the chest area also. Okay, good. A bit higher, lift arm. Yes, good, Ashish. Yes, relax. And again, good. Relax. And you can stretch your posterior shoulder also. Take your arm across. On the other side, use the other hand on the elbow and feel a good stretch on the back side of the shoulder. Okay, and hold this for about 10 seconds. Yes, good. Repeat on the other side. Feel a good stretch. Those who are getting shoulder pains may have problem with this exercise, so do it very carefully. Okay. And then usually our hands are working like this because of the laptop. So we need to stretch our hands also. Keep your hand straight up with the other hand. Yes. Feel a good stretch in the forearm. Feel a good stretch in the forearm. On the lighter side of the forearm. Hold there for again 10 seconds. Now change. Take your hand down. Again stretch. Feel the stretch on the dark side of the forearm. Repeat on the left side also. Stretch it up, up, up. Our tendons also need some mobility. So tendons, there are people who suffer with pains or trigger kind of fingers in this area because they are not doing enough of this. These days, there is a lot of fad about clapping. So probably clapping also helps in keeping this area very mobile or very active. Stretch again. Good. And on the So these exercises help us remain active. Then there is a standing extension exercise, which is similar to Cobra pose while lying down. So what you can do is you can stand up, keep your hand on your waist, and then bend backwards. Okay. So in between in the office, whenever, because we are sitting in a C shape all through our working hours, so we should get up and stretch. Yes, bend backwards. Keep your hand on your waist and bend backwards as far as you can. Good, good. Yeah, relax, come back. Stay in that position for 2 seconds and come back. Just 2 seconds and come back. Repeat 2 more times. Up, up, up. Go backwards, backwards. Yes. As far as you can, 2 seconds and then come back. Okay. One more time, last. Good. Yes, relax. So these are a few of the stretches. I'll share a PDF of these stretches or exercises with Ashish, and he can share with you. We should keep doing these exercises. We should keep doing these exercises all through our working hours to keep us active. So with the cervical problem, if someone is doing extensions, then as with the Cobra pose also, we have seen that people usually extend a lot of their neck backwards. So while you're doing your lower back extension, then try to keep neck or head at the same level with the shoulder. But if you feel any giddiness, if there is any giddiness while doing this, then please don't do this. Okay. So neck and back pain are very common occurrences. Now these are compared with the common cold. It could be as common as common cold. Proper support and ergonomics needs to be considered while working from home. Exercise and physical activity should be part of the lifestyle. Exercise can help in relieving spinal pain and related symptoms. You need to consult a specialist in case there are severe symptoms. I will introduce a bit about our work that we are doing these days. So active prehab, as I told you, we have started this considering the benefit of exercise and physical activity in preventing musculoskeletal problems as well as the effects of chronic problems. Chronic problems could be osteoarthritis or diabetes or hypertension. They also affect us. So how exercise and physical activity can help us being fit and healthy. And we are doing it by two ways. One is telehealth and other one is a group therapy. In telehealth part, what we do, we have been doing is we are doing an assessment on telehealth and then prescribing exercises through an app. So we have seen some very amazing results with telehealth, not just in people, for people who are suffering from spinal pains, but also in cases who are post-operative, post-orthopedic surgeries. We have seen amazing results. So this is a very good means of not going to a physio yet getting treatment done in the comfort of your home. And then there is group therapy. We are running an elder care group. We wanted to start this as physical group exercise programs in the societies, in the corporates, in the maternity clinics. But we could not do that. But during the lockdown, we did an online we started an online program for elderly when the lockdown just started off. So I was personally worried about my parents and people senior to my parents, that what will happen to them if they don't go out, if they don't do any physical activity. So in April, I was worried about this, that they will deteriorate drastically if they don't move out, they don't do any physical activity. So we started this online. I recruited my physiotherapist from my clinic and asked them to start a group for elderly, for friends and family and everyone. And they had such a good we had such a good response, and then everybody benefited out of it. Then we started off with elder care group online only. So we are running these programs right now. We are running spine care on the group therapy side, those who have recurrent back pains and they still, or they have suffered back pain or neck pains earlier, but now they want to do some kind of activity or exercise for their spine to keep them fit. So these two programs we are already running, and very soon we'll be running a program for new mothers also in the form of group therapy, and where they don't need to come or go to anybody. They can again do it from their living rooms on Zoom with our therapists. So thank you very much. I thank you again, Ashish, for inviting me here for this talk, and I hope people benefited out of it. And if you have uh, any queries, we can take up in a while. Thank you. Ashish, you are mute.
Thank you. Thank you, Dr. Gagan, for sharing those exercises. I'm sure people would have found that useful. May I request you to stop sharing your screen so that I can share the link to the feedback. Friends, I would just share a link to a feedback form, and please share how, did you find the session useful? It will take you less than a second to fill it out. And then we will open up the session for Q&A. And once you have filled in the feedback form, please type FD in the feedback form so that we know you have done the feedback. It takes less than a minute to fill out this simple feedback form. Surely, Sandhya ji. Thank you, Jagdish. Please fill out the feedback form. It will take less than a minute, and update in the chat, feedback done, so that we can resume with the session. Thank you, Kavna. And once you have done with the feedback form, you can also click on the YouTube link so that you can view the videos of the previous sessions and also this one. So this one also will be put up. Thanks, Harsh. Thanks, Sandhya. And I've also shared the link to our WhatsApp group in case you would like to get information about the sessions which are scheduled for the coming weeks. You can connect with us on the chat and you can get all the information. Just before we open up the session for Q&A, there are one or two things I would like to share with you. The session next Saturday will be at 4 p.m. again. And it will be at 4 p.m. and it will be by Dr. Nupur, and that will be the concluding session on our Dar Se Dream Tak series. In this, Dr. Nupur will be talking about the mindset of success. Many a times we sabotage our own success due to the patterns which are imprinted in our subconscious mind. So she's going to be talking about how to program our subconscious mind and develop a mindset of winning so that we can achieve all the goals and live 2021 like a winner. And I'm very, very excited to share with you that on 26th February, 7:30 to 8:30 a.m. India time, we will have Sean Fargo. He is my teacher and he's coming to address mindful living community. How awesome that would be, right? Are you excited about joining the session with him? On 26th February, 7:30 to 8:30 a.m. In case you are excited about joining the session, please type E in the chat box. He's a world-renowned meditation teacher, and there are very few public appearances that he does. His address to the mindful living community is one of the rare occasions where he comes out in the public to address. So that's the session on 26th February. So please mark out these times in your calendar. We will be sharing the information with you in due course. And with that, we will now open the session for any question and answers. I understand we are beyond our time, but we're happy to stay. Dr. Gagan, I hope it's okay for you to spend another couple of minutes to take any question and answers.
Sure, Ashish.
Thank you. Thank you, Dr. Gagan. So we are now open for Q&A.
Ashish, I have a quick question.
Yes.
Hey,
I have a question.
Yeah. Hi, Kar.
Hi.
Good afternoon, Dr. Gagan. So I saw the slides that you had, one of them which talks about the pain that comes from the neck, and from the neck, it moves either to the arms or at the back muscles. So I have a similar issue. So my pain has reached here, but what's happening for me sometimes is I feel like I'm just losing balance. Like I just feel like as if I'm holding something and I suddenly feel like I'm going to drop it off, but I'm obviously not. So is it because the nerves are compressing the muscles? And also I have an issue from the same side, I have an issue from my hip joint towards my knee and then to my ankle. So are these all related?
Look, the pain which is, as I told you, the pain which is coming to the arm may be related to the neck, okay? Or it could be shoulder. Even after some time, what happens is that because of some common musculature around the neck and the shoulder, what happens is shoulder also starts getting affected. And I believe what you are saying right now is the instability, or when you said that you lose balance, means that if you're doing some work, suddenly you feel some tinge of pain and it makes you leave that thing or stop suddenly doing that thing.
Yes,
isn't
yes.
it? So that is probably because of one awkward posture of the position of the shoulder, in which suddenly a muscle gets impinged probably and lead to pain in this region, which could have started because of this. But now maybe need to check the shoulder also, means whether it goes in full range, if on the back, behind the like this, if it is all painless. Okay.
So I had a frozen person's shoulder, this started, and then eventually I reached a point where I couldn't move my arms at all. But now it's close to a year, and I have full mobility. But otherwise, I couldn't move this at all. It just froze.
So maybe one or two means a little bit of problem is still persisting with this in certain position. Means we can check that if in this position there is pain, or at the end range when you push it back, then there's some slight discomfort which may still be there. And if it is not, then maybe with the neck movements or neck exercises, you can correct the problem on the upper back, and this gets sorted out on its own. Or maybe some strengthening exercise for the shoulder can be done to give you relief from this. Secondly, the pain that you are suffering from, or that comes in the hip region, the gluteal region, and goes down the leg is from the lower back. As I told you, most probably it is because of the lower back. So
I have a tight IT band. It looks like a tight IT band. So,
but does your pain travel down the knee, below the knee level also? Never. Okay, great. So it is good that it does not go beyond the knee level. Do you get back pain also? No back pain. Okay. So it could be IT band, but still I would like to check sometime how's the lower back, if there is full range of motion in the lower back or not. Okay. If there is not enough range of motion in the lower back, then that needs to be corrected before looking at any other reasons.
Just a question on that. Do you do online consultation as well?
Yeah, we do that. We do online consultation. We provide spine care online also.
Okay. So I'll connect with you after the session.
Sure, Kavna. We'll be sharing Dr. Gagan's numbers in a while, and you could connect with him. In fact, let me do that right away. I'll put up the screen and share his numbers. In the meanwhile, if somebody else has got questions, please go ahead and shoot them.
So there is a question by Shashidhar about epidural cause back pain. Just a second. Let me put on the chat.
Here are Dr. Gagan's numbers.
So you do exercise regularly, but there is a problem with the back pain with the wife. We saw regular orthopedic surgeon, but there's no other problem. So usually where this epidural injection is done, okay, so that part gets strained, not because of the epidural usually, okay, not because of that usually, but that is one of the sites where the load comes, okay. So where there is load, it is the same place where the load comes on the back, and people think that it is because of epidural. For epidural causing pain, there should be, repeated epidurals are done there, and there is scarring in that region that may cause pain. But I think it can be sorted out with right kind of exercises, Shashidhar. Means if her, again, range of motion is very important, we have to see like what we do usually is we check the repeated movements and see whether the repeated movements still cause the pain or not, if we can produce the symptom or relieve the symptom immediately. So we'll need more details about it, but usually it is not because of the epidural, but it is a common site for back pain. Okay. And then there is Shashidhar again diagnosed with golfer's elbow without playing golf inside the elbows. Yes, Shashidhar, you are right here. Means it's not that just the golfers and the tennis players get golfer's elbow or the tennis elbow. This is the term that comes from these sports, but it is not as common in these sports as it is common with the general public. Doctor says too much elbow resting on the desk as I work on the laptop. The other reason they said was because of pull-ups. I do. How do I recover? It is very slow because of less blood flow. Okay, so golfer's elbow means when we play golf, then this part, the inner side of the elbow gets pain. When it is outer side, then it is the back end of the tennis, which it relates to like tennis elbow. But if it is on the inner side, then if, as we told those stretches, I told you this stretch, isn't it? You should try this stretch, and you can speak if you want to, because then otherwise I'll have to check in the chat region. So when you're doing this stretch, you get a pain. You get pain on the inner side of the elbow.
So it used to earlier. It is reduced now. It is quite reduced quite a bit. It is recovering, but it's just too slow.
Yeah, it is usually a slow process. But how slow has it been? Is it over 3 months now or
Yes, yes, yes. Over 6 months.
over 6 months? So stretch, one part is the stretch, the other part is the strength. Okay. So while doing strengthening, you have to do, I'll write it down. I'll share 2 or 3 exercises with you, Sridhar. And then after those exercises, maybe for 2 to 3 weeks, I'll share the instructions also with you.
Okay.
Okay. And after about 2 to 3 weeks, you can leave me a message about how you're doing. Okay, so you have to do strengthening as well as stretching in a progressive manner. Okay, for about 2 to 3 weeks at least, but the timelines are 3 weeks, 6 weeks, 3 months, like that. Okay.
Okay.
But the exercise should be progressive in nature. Okay. And if there's no difference in your condition, then maybe need to assess or examine more, look at again maybe the cervical spine or some other reasons for this, not sitting down. Okay.
Okay.
Yeah. I have written it down. By tomorrow or Monday, I'll share a program with you. I'll pass it on to Ashish sir and he can share.
Perfect. Yes, wonderful.
I have also shared Dr. Gagan's number on the chat. If you would like to connect with Dr. Gagan directly, please feel free to do so.
I'll do that. I'll do that because there are bunches of things that we need to get sorted.
Sure, Shashi.
And there was one question, this thing by Sandhya ji about cervical spine exercises. Okay, so Sandhya ji, if you are here,
I think he's left, Dr. Gagan.
Okay, then I'll share general exercises for cervical spine, Ashish.
Yeah.
Okay, but again, I'll send a caution also in that. Okay, like when not to do it. Okay, and if any of the exercise gives pain, I'll leave those precautions also with it. I'll send general exercise program to you, and then you can share it further with her with all the cautions.
Sure, Dr. Gagan.
So, one can I ask one question?
Yes.
So, Dr. Gagan, you do all sports injuries, right? In terms of meniscuses and things like that. Yeah.
Yes. ACL, lot of ACLs, lot of meniscus repairs.
Yes. Okay. Thanks. I will reach out separately. Sorry, Ashish. That's all.
No, please, Shashi. Thanks for asking those questions. And we are here for another 1 or 2 minutes. If anybody has got a question, please feel free to put it in the chat or unmute yourself and ask them. Else we'll be closing the session.
Okay. Let me ask if no.
Yeah.
See, Dr. Gagan, the treatments move, in a circular fashion. Earlier, for example, nowadays there's a lot of stress on resistance training. For back, lower back, etc. They say do deadlifts, etc. Because I know a number of people my age who have had a disc bulge and herniated, trying to pick up a cylinder and things like that, right? Full cylinder, pick up on one side, and they have never exercised the lower back. So there's a lot of stress on resistance, but I think it's also becoming a little bit of a fad. And a lot of people are taking it up and getting injured. So how true is that? Okay,
To answer you, means as a physiotherapist, look, as long as people are doing things generally, okay, and they are trying to follow some routine in general sense, so fine. But if you are under supervision of a physiotherapist or a trainer, then the responsibility of which exercise to be done and which ones not to be done lies with them. And people need to follow that advice, because certain exercises either not done in the correct manner or done excessively can lead to aggravation of problem or can lead to new problems. So generally, if you're fit, if you don't have any ongoing issue with your musculoskeletal system, with any of the muscles or joints, then you start slow your maybe gym workout or your personal workout, and then gradually build it over weeks. strength wise. So core stability is one area which probably maybe you must be thinking about it, like when we talk about lower back. So core stability is one area which helps, but again, if that is causing you problem, if you are progressing way too faster in your exercises or not doing those technically correctly, okay, then there could be problems.
Okay, got it. Thank you.
Thank you, Shashi, for those questions. We will take one last question and then we will draw this to a close. If you have got any question, happy to take one. Otherwise, I would like to thank each one of you for taking out time from your busy schedule and joining us. Thank you, Dr. Gagan, so much for sharing about the correct posture and the exercises that we can do and keep ourselves fit and productive. Everybody have a nice weekend, and we look forward to connecting with you at 4 o'clock on coming Saturday on a session on Mindset for Success with Dr. Nupur Agrawal. Thank you.
Ashish, it's been a pleasure being here. Thank you very much.
Thank you. Thank you.